So it's my pleasure to introduce today Dr Joanne Yoong. She's an applied economist working at the intersection of behavioural economics and health and financial decision making. She's the founder of Research for Impact, a research enterprise based in Singapore, working to make behavioural and social science research accessible, inclusive and transformative for all. Dr Yoong, will you tell us a little bit about it, what led to its foundation, and sort of the type of work that you're doing in this space?
After graduate school, I came to Singapore to work here with the School of Public Health at the National University of Singapore. And since then, I've moved into appointments with the National University of Singapore and the School of Medicine in their Center for Behavioural Implementation Science, and at the Singapore Management University. But what I really wanted to do was to actually find an environment that would allow me to recreate that third space for independent and objective research that wasn't necessarily in the academic setting, but was very informed by the rigor of academia. And my sense is that Singapore is a terrific place to do this. We have incredible amounts of human capital. We have stakeholders who are committed to evidence-based decision-making, both in the policy world and the private sector.
How does that intersection of behavioural science and the decision-making in the health context kind of manifest in these spaces?
Yeah, so my sense is that here in Singapore, actually on a government-wide basis, interest sort of in behavior and behavioral science has actually been something that they've been exploring for actually quite some time. We know so much now about the fact that lifestyle and choice is so important to the kind of changes that we need to see. We know that the demographics are coming down the highway, and if we don't do something on the behavior side, we are going to be in a very challenging situation. Actually, we're going to be in a very challenging situation anyway. But if we don't do something about it and try to at least exercise some of those choices, it's going to be much more difficult. And I think with the swing towards understanding prevention, I think a lot of investment has been made to try to understand that in a more rigorous way. So I'm excited to see these changes. I think government is leading, but I do think that we are seeing a lot of innovation outside government as well.
So if you look at kind of through the behavioural lens at building healthcare systems in Singapore and other kind of Asian countries, what are some of the biggest challenges that are being grappled with, both at a public and private level?
So I think one of the things, when we spoke about this earlier, is that the Singapore health system is really going through a very radical change from a very episodic, acute-oriented system to trying to think about how we make this a person-centric, preventive first system that's based in the community. That's a radical transformation. And part of that is that we have learned as patients here in Singapore to appreciate certain things that are very difficult to change as a default. And so when you ask someone to change from a status quo and they feel that they've lost something, that triggers firstly a very defensive mechanism, and they immediately are already in that sort of a negative frame. Right? So there is an emotional response. I had something, you're taking it away. That's universal. So again, we have two different things to worry about. We have a healthcare system that's radically reforming from an organizational point of view. And some of that is getting doctors to buy in and to change some of those actual financial incentives around going from fee-for-service to a capitation model. That's one huge challenge on the organizational side. But actually also getting people to buy into this radically different view of how healthcare should be provided, what it means to be good healthcare, and what it means to have someone take care of you, and not necessarily going to the best specialist in the best hospital, but someone who's going to see you in the community, understand you, work with you, even if you're not yet ill. These are mindset changes that people have to meet us there.
I just want to turn a little bit now to kind of ourselves as Amplify Health. What are some of the biases we should be aware of and we should be managing for as we start to kind of build up our business?
So I'll say generally what we know in the behavioral science world about entrepreneurs and risk takers. We know that all entrepreneurs are overconfident. If entrepreneurs were well calibrated, we wouldn't have basically anything. And that's perfectly normal because that's the engine of innovation. That being said, it's always one of those things that it's wise to bear in mind. No one enters thinking they're going to fail, and yet the rate of failure is extremely high. The other thing I think, which is quite unique to your position as a startup, is that so in certain settings we find that when there are too many choices, part of the problem is that we are faced with choice paralysis. We're in a situation where we want to do the best thing, but we want so much to not do the wrong thing that we take too long to respond.
Dr. Yoong, thank you so much for your time and for your expertise and for being so generous with sharing all your experience with us. It's been wonderful having you here.
It was great. Thank you so much, Moray, and thank you all for coming today and for the great questions.